reasons for you to check out Freedom Mini Dental Implants. It's a free consultation, absolutely free if you want to know if you're a candidate. And that consultation that doesn't cost you a thing, what's that include, Dr. Ackerman?
Yep, so first thing when you walk in the door is we will take a 3D x-ray, and that's at no charge, but that just makes sure I want to have all the information. I want to know that you have enough bone, you're a good candidate. So we'll take that 3D x-ray, and then I will come in and talk to you about, your expectations, what you're looking to accomplish, do a quick exam, and we'll go over all your options. I'll show you all the models, explain everything. We'll go over cost. If you need to look at financing options, we have financing options. So it's about, maybe about a 30-minute consult. It's no charge, but at least lets you know what your options are, how the process works. And like I said, it's definitely no charge, so it's definitely worth the consult to see if you're a candidate for this and if this is something you're interested in.
All right, before we take a live caller, we had someone call in. They did not want to go on the air, but they were asking what's the difference between regular implants, a traditional method, and the mini implants. You explained that, but that's maybe a good time to show this model.
Yeah, this model explains it.
That's a jawbone, right? That is a jawbone.
Yeah. So, imagine this is kind of if you were missing a lower tooth. Even we do single teeth, not just all dentures. But basically, the mini implant is just a smaller diameter implant. So when I place an implant, I don't have to make any incisions or stitches. I make this tiny little hole, the one you can barely see. That is like my little pilot hole that I make when I place an implant. Versus the surgical method, a lot of times they have to make an incision, they place this implant, and then it has to a lot of times heal up another 4 to 6 months before they can even do anything with it. Versus the mini implant, obviously I don't have to have as much bone either, so a lot of people that were told they weren't a candidate for the surgical implant or that they had to have bone grafts or sinus lifts, I do not have to do that with the mini implant because I don't have to have a lot of bone, I just have to have some bone. And it just heals up faster because it's less invasive. If you have, a medical history, we don't have to take you off of blood thinners. There's a lot of things, just because it is so minimally invasive.
It's just better technology. It's like comparing a little tiny needle to a nail.
Yes.
And that's all you need, and it's just as stable. It's all good news, folks. We'll grab a phone call here. We've asked for callers. John, thank you for responding. Welcome to the show.
Thank you very much.
Hello.
Hi, how are you?
Good.
Listening to you just now, you almost had me in tears because I haven't had any teeth in my mouth since, for a good 6, 7 years now because they took all my old teeth out. The new dentures would not stay in. No amount of powder would do it. And they came back and told me my ridges were too short, whatever that means. And I figured that maybe they could have seen that ahead of time. I don't know, but it doesn't matter now. What matters is my health is deteriorating because of this. And if there's hope of getting something in there to chew with, that would be great.
Yes. So, John, I don't want to make a promise I can't keep, but certainly I have treated many patients, just what you're explaining. They have lost hope. They didn't think there were any other options for them. So please, please, please call and make the consultation. Just like we were saying, it is no charge. I'll take that 3D x-ray and confirm that you have enough bone for the mini implants. I know exactly what you're talking about. A lot of people, the ridge, once they take the teeth out, the bone heals up and the ridge is very flat, and it's just really hard to wear dentures. They don't get any suction. Just like you said, even with any amount of glue, they just move, and it's just hard to keep them in. So you give up and you stop wearing them. But a lot of times you still may have enough bone to place these mini implants where we can make a snap-in denture or something more permanent. So please call, make the consultation. It's no charge. We'll take that 3D x-ray and just confirm that you have enough bone and go over the procedure with you, and hopefully we can get you an option and get you some teeth and smiling. And like you said, I know we talk a lot about the looks, but quality of life and nutrition, and that's what it sounds like it's affecting you. So please call.
Yeah, John mentioned health deteriorated because a lot of these foods that you cannot eat with dentures, crunchy foods, vegetables, fruits, steak, which is high in iron, those kind of nutrients that you need. I could see where his health is deteriorating. John, there is hope now, and it's Freedom Mini Dental Implant. There's an answer. Let's grab another car and go to Yvette. Yvette, welcome to the show.
Thank you. Thank you. My question is, should a person be concerned about the implants affecting their bones and maybe having to need a root canal once the implant is in place. At some time, it may affect the root.
So usually when we're placing an implant, the entire tooth has already been removed. So a root canal is when you still have a portion of your existing tooth. They essentially just take the nerve of that tooth out, so you get to keep your tooth, but it can't cause pain, or because the nerve is taken out. So to answer your question, no, because usually when we're placing an implant, there's no natural tooth left in that area, so you wouldn't need a root canal. Usually, you have a tooth removed probably because maybe it already had a root canal or it cracked and there was no other option. And so an implant gives you another option to replace that tooth once you have it extracted. Because once you remove a tooth, your options are, if it's all your teeth, is just a regular denture, unless you do implants, or if it's a single tooth, it's a partial that comes in and out, and everybody hates those, or it's a bridge, and you may have to drill on the teeth next to it that are healthy teeth. So an implant is a great way to replace a missing tooth once you've had the entire tooth removed.
And just to clarify, because I want to be clear here, okay, she mentioned a root canal, and everyone knows if you've ever had one, you do not want a root canal. This is a lot less invasive, and it's really just a numbing of the gums. This isn't like a root canal, folks,
correct.
right?
Yes, and it's normal. I have a lot of patients that come in for their first implant. They're a little nervous. They're excited to get it done, but they're nervous. They've been through fillings and root canals, and a lot of times, I get the patient numb, and I place an implant, and I always tell them, I'm like, okay, that's one in. If we're doing multiple, and they're like, really? And I'm like, yeah, that's it. And they're like, you just see that sigh of relief. They're like, oh, that wasn't bad at all. They're like, that's so much easier than a filling or a root canal, because it's not that drilling, that high-pitched drill and the powder, and you don't have to have your jaw open for hours. So it's really, a much simpler process than I think a lot of people conjure up in their head.
571-5263 if you have a question. Are you a candidate? Is your husband, your wife a candidate? Dr. Ackerman can address that, and believe me, the consultation is free, so it's all good. You mentioned a single tooth. So let's say genetically you're missing a tooth. Perhaps you had an accident, maybe softball game or a car accident, you're missing a couple of teeth. You can do that as well, right?
Yes.
Okay,
so,
show us that model.
Definitely
this is
show
cool.
that model. You mentioned being, born without a tooth. I actually recently had a patient. Some people are, don't have a permanent tooth, and a lot of times they may retain that baby tooth for a long time. So we just had a patient, her baby tooth finally gave up on her. She was in her 30s, and we removed that baby tooth and we placed the mini implant. Same process, no incisions, no stitches. We'll place the implant, and then we can do a single tooth where it cements on permanently onto that implant. So if you had a flipper or a partial replacing that, you get rid of that. Similar concept, it doesn't have to just be one tooth. You could be missing 2 or 3 teeth, like this model showing missing 3 teeth here. A lot of people are missing their back teeth, your molar teeth. So we can place the implants there, replace multiple teeth, make a bridge that gets cemented on permanently onto those implants. So no longer, you don't have anything that comes in and out. You don't have a partial anymore. I had a patient kind of refer to that if they felt like their teeth just grew back, they didn't have to deal with that partial. They weren't missing teeth. They could chew better again, but it stays cemented on there. You're going to brush it and floss it just like normal teeth. So we can do 1 tooth, 2 teeth, multiple teeth. It just, depends on the situation, but we don't just do dentures either. So.
Snap-in dentures are great, but the other option is just no plastic, just teeth. And it's like she said, it's like having to grow in another set of teeth. So we'll show you that option next. Also, more phone calls. 571-5263 if you'd like to talk to Dr. Regan Ackerman from Freedom Mini Dental Implants. We'll be back after these. Mini dental implants. She is Dr. Regan Ackerman, and the answer is here, folks. Throw away the dentures, get rid of the glue. If you have an issue, you want to make sure you're confident with your smile. We all understand that. You can do it with Freedom Mini Dental Implants. We're taking phone calls. Ernestine was nice enough to call. Ernestine, welcome into the show.
Hello.
Hello.
I went to a dentist, and I was told I needed a bone graft if I was going to get an implant. And I've thought about the mini implants, but I was worried because I'm missing my molar that because the shaft is so much smaller, is it as safe as the larger ones?
Certainly.
The traditional.
Yep, and I get that question a lot, especially with molars. And this is one thing we would definitely go over the consult and kind of show them the model. But whenever I replace a molar tooth, I actually use too many implants because it acts like the roots of a molar tooth, and it gives that stabilization. So that is kind of a misnomer. A lot of people think, oh, it's just one little implant for a bigger tooth. But because molar teeth are bigger teeth, we use too many implants, and it stabilizes it just as well, if not better, than one surgical implant, because now you have two implants supporting that bigger molar tooth. So definitely it could still be a great option. I do a lot of molar teeth with the mini implants, and have been able to help a lot of people that were told they had to have bone grafts and sinus lifts, and we didn't have to do that with the mini implants. So
yeah.
Great question. Very good question.
Really good question. Thank you, Ernestine. Yeah, because I would think, you know, when you see supports, as far as the balance and support, if you have two, much better than one.
Yep.
So it's going to be much more stable.
Say we kind of recreate what God gave you. We give you two implants, two roots of a molar.
There we go.
Yeah.
I like that.
Yeah.
Okay. Let's show folks what the teeth alone model looks like. Okay, this is another option. We talked about the snap-in dentures. So if someone says, I want no plastic, I want to throw away my dentures, this is the method.
Yes. This is one of kind of the nicest things we do for sure. Same thing. We're going to place the implants the same way. No incisions, no stitches.
So that's just your gums. That's not a denture.
If you're just missing all your teeth, these are your gums. And I don't have to put you to sleep or anything. We're just going to place more implants for better stabilization. And then we're able to make just a bridge of teeth. So it's no more bulky plastic denture. And then this gets cemented permanently onto those implants. So it doesn't come in and out. It's cemented on there, so there's no movement whatsoever. It no longer covers the roof of your mouth. You get to taste your food again. You're gonna, you know, brush it, toothbrush, toothpaste. We give you a water pick just to kind of flush and keep the edges clean, and you'll get it cleaned every 6 months. It's just like having regular teeth, but then, you know, you can bite into anything you want, eat steak again, carrots, celery, salads, and you get to taste your food again, and you don't have to have a big piece of plastic. You don't have to have a denture in your mouth anymore.
All right. Nice option there.
Yes.
Yeah, changing people's lives for the better. Ken joins us now. Ken, welcome in. You have a question for Dr. Ackerman? Hello, Ken.
Yes.
Yes, go ahead.
Yes, the question I had, can those dental implants be done if a person has had an osteotomy?
An osteotomy. Can you explain that a little bit more for me?
Yes, I had a real bad underbite, so they took a piece of bone out of my hip, and they put up in my jaw, my upper jaw, and I have 4 wires in there still.
Gotcha.
And I didn't know if those implants would work, being I've had that done or not.
Yeah, so you kind of had jaw surgery.
Yes, ma'am.
Yeah, so certainly probably could. It's a matter of taking that 3D x-ray and just making sure, you know, that it healed, you know, the right way, and that those wires aren't in the way of where I might need to place the implants. So it certainly does kind of depend on the situation, but I certainly don't see why it couldn't negate you having implants, but it's just something I would have to see, you know, take that 3D x-ray for sure, which is no charge with the consultation, but you could definitely still be a candidate even though you had that jaw. And actually it's kind of nice that you did have that jaw correction surgery, because that means you probably have a better bite and increases the success rate of the implants. So great question.
Interesting. Yeah. We've had some really good questions.
I haven't had that one before. That's a good one.
You know what's cool about that is if you get the bone from your hip put in your jaw, your teeth can dance, and it's like a whole added benefit. I mean, it's really cool.
That's right.
All right. I want to take a look at Chad again, because folks, proof's in the pudding. If you're just now joining us, this is Chad, who went to Freedom Mini Dental Implants. He said, yes, I want the procedure. Tell him a little bit more about Chad. Look at the difference. And I do think, don't get me wrong, the beard looks good, but he was hiding his smile. I think he would say that.
He was. So yeah, kind of like we mentioned before, and our caller mentioned, he was just struggling, could never wear his dentures, and gave up on his dentures. And I see people every day that, you know, have just given up, or they wear their top denture, never wear their bottom one. So definitely help Chad out. And there's many people out there, and some of them might even be your your loved ones or family members or friends that, and they don't talk about it because it is a stigma that they have dentures or they're missing their teeth. So if you happen to know or think that, you may want to reach out to them and see if they've considered this, because so many people are struggling with this. I always say I do not wish, regular dentures upon my worst enemy, because they're just hard to keep in. I can make, any dentist can try and make the best regular dentures in the world, but you're still not going to like them. You're going to have to use glue. They're going to move. They're not going to stay in. So the mini implants just gives you a much better option for better quality of life, and either with the snap-in dentures or get rid of that denture completely and throw it away.
All right, we've got a minute remaining. I think we can field the call with Patrick. Patrick, welcome in. You have a question? Hello, Patrick. Patrick.
Did we lose him?
We may have lost Patrick. That's okay. Are you there, Patrick? Thought I heard a voice.
Yep.
Okay, real quickly before we let you go, consultations. Okay, we mentioned that they are free. Where are you located? You mentioned also it takes about 30 minutes, so that's all the time that you'll consume there, right?
The consultation's about 30 minutes. I mean, obviously, if you decide to start treatment that day or anything, it could be longer. But we're on Dixie Hwy across from Valley High School, so we're closer to the Gene Snyder exit off of Dixie Hwy. So yeah, come see us. It's a free consultation. We're a small office. We're not corporate. You will see me. I'm the only dentist there. Small family-owned office.
Yeah, very nice. Promise you they don't bite. I'm trying not. These dad jokes are just horrible. All right.